Hey, this is Dr. Tim. I want to take a few minutes talking about the sleep apnea appliances I use for adults. Now, at this point, we've already done our 3D jaw scan, our CBCT scan. You may have already had your sleep study done. The sleep study needs to be interpreted by a board certified sleep physician. You can get your medical diagnosis based off of that. That gives us the data we need to decide and determine what's the best approach for the sleep apnea. Now, when we're addressing sleep apnea, we have to decide on where is the airway too small and why is the airway becoming collapsed or affected. Airway is a space issue. So is the space too small inside the mouth, meaning tongue space? Is it behind the tongue going down here? Is it inside the nose? Think a deviated septum. Or is it behind the nose, the upper part of the airway, like where the adenoids would be? If a child has an inflammation with tonsils or adenoids with that. So how can we make those spaces bigger? Sometimes it can be, let's just have the ENT open up the nose. But if it's inside the mouth or behind the tongue, a lot of times it's how do we increase that space or prevent the tongue from dropping back, all right? Adults can have options to deal with their sleep apnea. Some options become surgical. Some options are a CPAP machine, but for people that don't want to have surgery, they don't want to wear a CPAP machine, maybe they don't tolerate a CPAP machine, then the next best option would be what we call like a dental sleep appliance, something that helps to hold the jaw forward and or increase that tongue space, that volume of the airway. So if we're purely looking at something to just hold the jaw forward, that's all that somebody needs or wants. They don't want to go through orthodontics, the surgery, make the jaw bigger, expansion, those things. Then I'll use something that I call a prosomnus sleep appliance. A prosomnus sleep appliance is 3D made, and we use a digital scanning machine to take digital pictures or digital impression of your teeth, and Prosomnus makes this appliance. So there's a top and bottom, a clear acrylic custom fit appliance that has these wings on it. So these wings are on the side. The wings can be made in different positions depending on how far forward we want to move the lower jaw. And there will be one on the top, one on the bottom. And then if this is the lower, that when you are, right here, if you're laying back at nighttime, then the lower and the upper, those wings come together so that if this is the lower jaw and you're lying on your back, the lower jaw can't drop back this way because it's being held in by the top. So the tongue and the lower jaw are held more forward, preventing the collapsibility of the airway. Think like CPR, jaw comes forward, tongue comes forward, airway opens up. So all this does is it just manages the airway. It can be a great option for people, even a great travel appliance option for people that don't want to lug around a CPAP machine. So purely managing. Another option I use is something called an mRNA appliance, and this is something that is made by a company called Vivos Therapeutics, and basically this is just aimed at, can we, if you already have to wear a sleep appliance, can we increase that space and make the airway bigger? So this is an appliance that has the same type of wings and it's custom made as well, but this appliance actually has screws in the middle of it. It has these springs on it as well and has this Y-split in the middle. So as you turn the screws, it pushes out and it pushes forward as well. So we know with adults that the bone is mainly solid, but like kids, we can still develop and expand the jaw. There are limitations with how much we can develop non-surgically in an adult, but for the adults that don't want the surgical option, this can be a great conservative approach to slowly over time, 1 to 2 years, you're wearing this at nighttime, a little bit during the day, that can we grow the jaw out, bring the teeth with it, increase tongue space, increase volume of the airway, decrease airway, airflow resistance with that. And so it's the same type of thing as that Prosomnus appliance, but this time it has the wings on the top and bottom, so the lower can't drop back. And so now we're protecting the airway at nighttime, but also the springs and the screw for the expansion, we're creating positive permanent change with these. Now these appliances may start to shift the teeth out, open up space between the teeth, alter the bite a little bit. And so after this, a lot of people will go through some orthodontic process, usually with Invisalign, and that will start to level and align the teeth, further create some space and some airway options with that. So just two different choices, two different tools that we can use for conservative, non-surgical management of adult sleep apnea. Thank you.